The World Health Organization has just said that over half of Europe's population will test positive for Omicron in the next couple of months if infections continue at current rates. As Omicron becomes the dominant variant across the world, some of you have been sending us your questions about the COVID situation and the impact that it has on travel as well. So let's answer some of those questions. Joining me is Professor David Montefiore, immunologist at Duke University in Durham, North Carolina, and Julia Bue-Said, CEO of the Advantage Travel Partnership. She is here in London as well. David, can I first get your thoughts on what we have just been hearing from the World Health Organization? Predictable, do you think that half of Europe is going to have Omicron in the next few months if infection rates continue like this?
Yes, indeed. I think that is going to be the case. The Omicron variant is so much more contagious than any previous variant that we've experienced. And at the current rates, it's looking like those predictions are going to bear out.
Can I bring you our first question, though, from Simon, who wants to know about how severe Omicron is now looking, because he says, with the data we have now, is it accurate to now say that Omicron is like a bad flu?
Well, it really depends on the person. The symptoms of Omicron infection vary across the spectrum of the population. So people who are younger, who have healthy immune systems, oftentimes the infection can be asymptomatic. They don't even know that they've been infected, or the symptoms are very mild. It's people who have weaker immune systems, so people who are older, have immunosuppressive conditions or on immunosuppressive drugs because of an organ transplant. Those are the people who are susceptible to serious illness and death.
Julia, our first question around travel is very much asking how much things are changing, because it does appear that the effects of Omicron in terms of on people's health is less severe.
Yes, absolutely. Well, we've seen the UK governments reduce their restrictions over the last week or so. What we've not yet seen is a change in policy across other nations. In fact, today we've seen a couple of destinations who have increased their restrictions on travellers travelling into their destination.
Peter, here's a question, David, from Peter. Why has herd immunity not worked, he asked. In many countries, over 80% of the population is vaccinated, he says. Why are we still seeing these record numbers?
Well, we're seeing record numbers of infections because the vaccines are not protecting people from getting infected in the first place. But we are seeing reductions in the ratio of people who are getting severe illness and dying from these infections. So the proportion of people who are getting seriously sick, very severe disease and dying is relatively low compared to the number of people who are getting infected. And that is because of the vaccine. We are reaching a point of herd immunity in terms of preventing serious illness and death. But unfortunately, the vaccines are not protecting people from getting infected. And for most vaccines don't prevent infections altogether. What they do is prevent disease.
David, we've had a couple of questions around this research that's been done that suggests that having a cold over winter could protect you from COVID. What are your thoughts?
Well, that's highly unlikely. Certainly there are other coronaviruses that cause the common cold. Common colds are caused by other viruses as well. If you happen to have one that was caused by a strain of coronavirus, that strain is so much different from the coronavirus that causes COVID that the immune response is very unlikely to cross-react very much and provide much protection.
Julia, we have a question here from Brenda for you. I am still testing positive for COVID, she says, but I have completed my 10 days of isolation. Can I still travel with a positive test, but if I no longer have symptoms?
That's a really good question. I'm not sure where Brenda is, but if she's in the UK, as it stands right now, unfortunately, the UK guidelines, the NHS guidelines do not align with international travel rules. So most destinations, Brenda will find that they will require her to confirm that she has not tested positive within 14 days. And she will also most likely have to present a negative PCR test on arrival. To add even more complication, when you test positive in the UK, you actually lose the use of your travel pass, so you cannot prove your vaccine status. So anyone that's recovering from COVID or still testing positive, international travel becomes very, very complex.
On travel too, David, Oliver asks, given the prevalence of Omicron around the world, what is the benefit of pre-travel testing for visitors to any country?
Well, one of the benefits is that you're going to have a lot of people crammed into a closed space on this plane for hours at a time, depending on where you're traveling from. And if you have one or two people who are infected, that infection can spread even with people wearing masks because you're in such close proximity in a closed environment for such a long period of time. So you're going to reduce the chances of having spread basically a super spreader event on the plane by having those types of restrictions.
David, from Richard, are we still vaccinating using what he calls the original vaccination recipe? And if so, when will the jab include a recipe for these variants, basically?
Well, fortunately, the original vaccines that are based on the original Wuhan strain of the virus are still working. It does require an extra boost. But they are still working. And that's because even though we have these variants now, and especially Omicron, with all of these mutations in the spike protein, still over 95% of the spike protein is the same spike that was in the original strain of the virus and that's in the vaccine. So there's still a lot of targets on the spike protein that haven't changed for the immune response to focus on.
Julia, as I'm sure you've been hearing, there is so much confusion over all of the rules, and I think that this question possibly reflects that from Roger, who wants to know what fully vaccinated actually means for England particularly. Is it just a double vaccination, or do you have to have had your booster as well?
Well, for now, in terms of what Roger's asking there, for England, you only need to be double vaccinated. The booster does not count with regards to that. So double vaccination is more than sufficient for now for England.
And Julia, have you been getting a lot of that, just absolute frustration and confusion from travellers about what they need to do?
Absolutely. It is exceptionally confusing. I think the really confusing part is you have to look at everything in two ways. One, where the country you're going to, but also the country you're returning back into. The rules don't align. Everyone is taking a very different view. So it's really, really important to make sure that all the rules are checked and scrutinised for both areas.
David, we've got a question here about different variants. Over the past few days, there's been some headlines around a variant people are calling Deltacron. How worried should we be about new variants? How often does a new variant emerge?
Well, first of all, the Deltacron does not seem to be a concern right now. It's likely a recombinant. We're only concerned about variants that spread and become very prevalent in the world. How concerned should we be about variants? I think that we always need to be vigilant and be monitoring for new variants when they emerge. We have seen 4 major variants that have outcompeted previous variants to dominate. We started with the D614G variant in the early spring of 2020. That was replaced by the Alpha variant, which was subsequently replaced by Delta, and now we have Omicron. And it looks like about every 6 months, we've had a new variant that has outcompeted earlier variants to become the dominant one in the world. When the next one is going to occur, if another one is going to occur, we really don't know. But if you look at what's been happening over the past 2 years, it looks like a cycle of about every 6 months. There's a new variant. It's hard for me to imagine a variant of this virus that's going to be even more contagious than Omicron. It's more likely that Omicron might change to possibly escape our vaccines even more than it has, at which time it would probably be necessary to change the vaccines. But so far, we haven't needed to do that. With Omicron, it does require extra boosting to get that immune response up as strong as it can be. But we're still good with our current vaccines for the current variant.
Well, that is very good to hear. Many thanks to you both. Professor David Montefiore, immunologist at Duke University in North Carolina, and Julia Bue-Said, CEO of the Advantage Travel Partnership Group, joining us from here in England.